At 9 on Good Day Columbus, Good Day Goes Pink. We're dedicating our entire 9 a.m. hour to Breast Cancer Awareness Month.
We'll have inspirational stories of survival, new treatments being offered here in Central Ohio, and much more. Standing Up to Cancer. That was a great concert, by the way. October is Breast Cancer Awareness Month.
Yes, it is. And this morning, Dana Turtle is live at Breast Health Center in Dublin, where state-of-the-art technology is helping doctors better diagnose the disease. Dana.
Yeah, so this is really cool. Ladies, when you get a mammogram, it goes to a guy named Dr. Zad right here. You're a radiologist. Good morning, doctor.
Good morning.
So tell us what exactly you're looking at here once somebody has a mammogram done.
Well, here's a mammogram image here. It's a CC view, so the breast is compressed from top to bottom, and we always look for symmetry from side to side. How does one side look different? Now, in this case, we see a pretty obvious looking rounded mass as one of the first signs that there could be something happening. Now, there are other secondary signs that we can look for too. We can look for calcium deposits, we can look for thickening of the skin, we can look for retraction of the nipple or even retraction of the skin. But let's get back to calcium, because calcium is an important thing I want to talk about. And here's a different patient on this side here. This, by the way, is a sideways view. We always get profile views as well, instead of CC films.
Sure.
But then, sometimes what we can do is magnify the images, and when we find calcium, we can get a good look at them. And what we look for is pleomorphism. In other words, some of the calcifications are round, others are linear and branched. And when we see this, that can be one of the early signs of cancer. And the good news here for ladies that get their mammograms is these early cancers that have just deposited calcium before they formed a mass, before they've spread anywhere, these early cancers are the ones that we can treat and cure and have the best chance for curing.
So what's the age that an average woman should have something like this done, a mammogram?
Well, the recommendation is between the ages of 35 and 40 for a woman to get their baseline mammogram. After that, the American Cancer Society still recommends yearly screening after the age of 40.
So it's all about catching it early, and that's your best chance.
Early detection is the chance to cure a patient, and that's why these large studies of large populations show mortality diminution or improvement if they get their mammogram. In other words, screening saves lives.
So you've got this amazing equipment to check this out, and you guys have a new thing now where you can see this in 3D.
That's correct, breast tomosynthesis. And
Tomosynthesis, okay. So we're going to come back at 50 after the hour, Carolyn and Pete, and we're gonna show you how the 3D aspect of it works. But amazing stuff. This is the guy that can find out whether or not you have a problem or not once you have a mammogram. So there you go. It's really important work.
Thank you so much.
Thank you.
Awesome.
Thanks, Dana.
Thanks, guys. It's so cool that he can just look at that and tell the difference between, like he said, just a regular calcium deposit and something you should really look into.
Right, and I think as, you know, women and men, but as a woman seeing that, anytime you get some sort of x-ray, everything looks scary. You never know, is this normal, is this not? So it's important to see that side by side. So we'll check back in with Dana. Inspirational song for Breast Cancer Awareness Month, Stronger.
How about that? Sean Ireland is here with a daily poll that relates to that. Of course, we're seeing like the pink everywhere.
Exactly. And, you know, we think about it all the time, but certainly to have a month dedicated to it is a good thing. 1 in 8 women now. Last year was like 1 in 9. 1 in 8 women will be affected by breast cancer. 1 in 1,000 men are affected by breast cancer. And 85% of these are not breast cancers due to family history. So that in itself makes you question, is it something in our environment, what we're eating, what we're doing?
When you think about it, I mean, just about everyone, it seems like we know someone who's been affected by this.
Exactly. So we want to ask you that very question. How many people do you know who have battled breast cancer? All right, your choices are pretty simple. None, 1, 2, or sadly, too many. So let us know. Go to SeanIrelandShow.com. And curiosity is what this is about. And we'll find out if the statistics bear out. Hopefully, we can turn the tide, maybe, one of these days.
It is 8 minutes before 9 o'clock. Hey, speaking of looking inside the human body, there are new ways now that we can go inside the body to detect disease like breast cancer. Dana Turtle is live this morning at Dublin Methodist Hospital. And Dana, this is so cool. You're going to be talking the next generation of mammograms.
Yeah, this is basically what we're talking about, kind of the next generation of what radiologists do, like Dr. Zad. Good morning, Dr. Zad.
Good morning.
All right, so when a woman goes in and gets a mammogram, you're the guy, one of the guys, who takes a look at it and finds whether they're good to go or not. And you guys have, what, this new 3D thing that you use. What's it called? And show us how it works.
Well, this is breast tomosynthesis. Now,
Tomosynthesis.
Tomosynthesis.
Okay.
Now, we at Ohio Health actually were the first in the state of Ohio to get it at our Riverside campus.
Okay.
And I'm going to show you an example of a case here. Now, here's standard profile films of the breast, right? Now, these are the sideways views. We see all the breast tissue from front to back. Now, what if you were able to take that information, cut it up in 1 millimeter slices all the way through? That's exactly what we're doing. It's like a CAT scan. So right now, we're paging through the breast 1 millimeter at a time, okay? Now, what that does is it takes all the overlapping glandular densities and gets them out of the way of what you want to see. For example, in this case, there's a spiculated mass right here, and it shows up really well on that specific tomographic cut. But I would argue to you, if we just looked at the standard mammogram, it's kind of hard to tell. It looks just like glandular tissue. On this case, we ended up getting an ultrasound. It showed an obvious mass. We biopsied it. It ended up being a cancer. And I got to tell you, Dana, this is a case that if I read it with a standard mammogram, I may not have called it and may not have caught it.
Wow, so the technology gets better and better.
Technology gets better and better and better.
All right, well, thank goodness for people like you. Absolutely. Okay, so coming up, Pete and Carolyn, we are going to go into one of the rooms where the mammograms are done. If you've never seen one of those rooms before, we're going to take you in there and introduce you to a nurse who can tell you what to expect. So
all
there
right.
you go.
Thanks,
really
Dana.
Good stuff with technology.
We look forward to that. The technology's cool, and getting in that room maybe put a lot of women's minds at ease, too. So we look forward to that.
You know, everyone knows someone affected by breast cancer. Local teacher and mother of 2 boys, Jody Brown, was diagnosed 2 years ago. And after 2 years of treatment, she will have her final surgery at the end of the month. And our very own, look at that picture, our very own Maria Durant is a breast cancer survivor. She was diagnosed in 2005. The cancer was found in her very first mammogram. And both women, they're here today, and they're going to share their stories with us. Thank you so much.
Of course, we have to show that picture. You know, that was a troubling time.
Yes, you know, and that is a really good question, because as you see that, does that seem like yesterday or forever ago?
Well, look at her eyes. She's tearing up already.
Tearing up
You do
already.
this to me every time,
I know.
girl. Every time.
You know, for me, it's both. You know, I mean, I know I've come a long way, but when I start talking about it, then it just seems like yesterday. You know, I remember so many things that I went through, and the people that I've met, and I mean, you know, it does feel like yesterday.
Does it define you to some extent? Are you mad about that?
I'm not mad about it. I went through, you know, the roller coaster. At first, shocked that,
Sure.
oh my gosh, this happened to me. You know,
How old were you, Maria?
I was 35.
35. Okay.
The very first mammogram.
My very first mammogram, and I thank my doctor. Because, you know, they say that you should be 40. That's the recommendation,
Right.
to be 40 years old. Well, you know, my husband and I, we wanted to have our second child. And my doctor's like, you know, you're healthy. Why don't you go get your baseline mammogram? Okay.
Yeah.
So that's when we found it.
Huh.
And it was, you know, it doesn't run in my family. There's no family history.
Wow.
You know, I'm an Asian woman. That's supposed to be a low category for breast cancer. But look, you know,
yeah.
so, but that's one of the reasons why, you know, I talk about it is
Sure.
because it can happen to anyone.
Anybody.
Anyone.
Yeah.
It doesn't matter how old you are. You know?
Jody, what was your story?
So I was diagnosed March 10th of 2010. I was 32. You know, I felt something like a bean size in my left axilla, my armpits, and I just go to my OB and I said, you know, I feel something in here, and she felt around for a good 15 minutes, and she goes, honey, I just don't feel anything. Let's just, you know, go about your business, and if you notice anything different, please let me know. Well, by February, it was the size of a golf ball.
Oh, goodness.
I mean, it was protruding out of my left armpit.
Wow.
So I go, well, gosh, what is this? And I'm very active, and my range of motion was not correct. So I go to OSU Sports Med, and she looked at me and she goes, honey, you need a CT scan. And it was that day, and then from there, it was just a roller coaster of scans, of we don't know where this is at. So I didn't actually have a lump in my breast. It all
It
filtered.
was on the. Now you showed it. I mean, show us.
Oh yeah, it was right in here.
And were you good about exams, or I mean, it had nothing to do with a breast exam? It was just.
Well, you know, so I really take care of my body,
Sure.
as us all females do. So we try to.
I mean,
Say, speak for yourself, Jody.
exactly. I'm like,
No, but seriously, you were very aware.
I was very aware of what was going on. So you know, we go in, and it was actually huge in my left armpit. So I went through probably a week's worth of scans, and we couldn't determine where was this cancer. And that was the worst part for me. It always is when they say, hey, you've got a mass, but we don't know where it is or what it is. So it's that gray area of waiting in between the scans and just trying to figure out what treatment plan it is.
Yeah.
So when I finally got diagnosed with breast cancer, it was just huge relief. You know, I was really numb and speechless for a good week and a half.
Really?
And finally my oncologist sat down and she grabbed my hands and she goes, you have breast cancer and you will be a survivor one day and you will help other women. So that's why I'm here, and that's what motivates me, and this is why I want to tell the whole world that there's life after cancer.
Absolutely there is.
You
I mean, how are your
live.
kids doing? You're juggling so much.
You know what? But they were so important in my survival.
Yeah,
You know what I mean? My boys, my oldest boy, he was 4, going on 5. He helped me drain my drains. I tried to not scare them with the information, but to involve them as this being a positive thing in our lives.
And I'm sure, well, and as a mom, your head has to go there, right? Of course, you're worried about yourself, but you're probably more worried about your
I had
kids,
some dark
right?
moments,
Yeah.
and my husband was there to, you know, pick up the pieces. But that was just our private moments at night when you can let your guard down, which I'm sure you did, and you talk about it, and
You know,
you're scared.
I think you both bring up something really important, and that is that you did have a support system.
Oh, yes.
And there are so many who don't. For those people, and maybe there's someone who wants to reach out to someone who is not married, does not have that. How do you reach out to somebody? What do you say to somebody who's been diagnosed with breast cancer?
I mean, I guess the first thing to say is, you know, there's hope. You know, you can get through this. I mean, you really can. There's so much out there now. You know, with technology, new treatments, new medication. There's so much out there that it doesn't have to be as bad as it was 20 years ago.
Well, and
You
it's
know,
not an
we're
automatic
proof.
death sentence. I mean, I think we can just
Absolutely.
say it, right? Because it's scary. I always want to know, and we do have to wrap up, but we were talking in our meetings planning for this show, and I want to know, as a friend, as a coworker, how do you support someone? Do they want to talk about it? Do they want to talk about anything? But do you just have to feel it out and just be honest?
I think you really do have to feel it out.
And just ask them? Yes.
Everyone is different.
Okay.
I have met women that do not want to talk about it at all.
Okay.
You know, it's very private. For me, the way to cope was to talk about it, and I really felt that, you know, being in this business is the one way that, you know, I can share my story and help others. That's how I cope.
That's good.
But not everybody is like that.
Sure.
So just ask them, I guess, right?
Yes.
And Jody, you have another
I-
surgery around the corner, correct?
Yes, yep.
Okay.
I get my nipple reconstruction, and that is the end for me. It's been, you know, a long 2 years, so we are going to celebrate.
That's terrific.
You betcha.
Yes, so thank you so much
You're
for
an
asking.
inspiration, both of you. Thank you.
Here,
for
I want to
sharing.
give these to you guys.
I was hoping for this today.
I have
There
one
you
in my
are.
wallet,
Okay,
so
all
now
right,
I have,
make sure
we'll do
you
it
wear
here.
a pin.
Going to wear a pin.
There we go.
Thank you guys so much for sharing your stories,
Thank
and
you.
Maria, for all you do in this community.
Absolutely.
Absolutely.
Keep fighting for a cure.
We'll get there. Mammograms are so important, as you know, in the fight against cancer.
Yes, you heard that from Maria, and last week I got my first mammogram. Dawn came for a little moral support. I did get the results yesterday, so I will share those with you next. And we're also going to talk to a radiologist. It's not about me, but we wanted to use this as a way to talk to a radiologist about what women need to know about mammograms, where technology has taken us.
Exactly.
And we're gonna kind of dispel some myths, get you through the fear.
Good news. That's coming up next. And that's what we're talking about. The theme today is breast cancer. Everything we need to know about it. And you were a superwoman yesterday. Do you know that? Well, not yesterday. I guess it was last week.
I don't know about Superwoman. No, I just went to get a mammogram, but Dr. Lauren Miller is here. We're going to be talking about mammograms and technology. The doc sent me this letter saying you're in the clear.
Oh, fabulous.
Which was great, and I didn't know, I've never done this. And I went, I guess, to the gynecologist in January, and they said, well, you've got like 3 years. to get your baseline mammogram. First of all, I mean, I'm a fairly educated person. I didn't know what that was. I had no idea what a baseline mammogram was. And second of all, I was like, 3 years? Okay, I'll mark it down for 2015. But we decided that I should go so we could share the experience and what it's all about. So first, Doc, tell everybody what a baseline mammogram is. And we're going to show you some pictures of the whole experience. Should we show the video first?
Let's do that. And Dr. Lauren Miller, we need to introduce her as well. She's with us from Ohio Health Radiology. And we will go over those results and what exactly you experienced. But here was our day with Lisa's very first mammogram.
We're going to do 2 pictures of the...
Oh, do you like my robe? It was very attractive. Ay, ay, ay.
You're going to be compressed between these 2.
I will tell you this. It did not hurt at all. This is the nurse kind of walking me through what to do, how it was going to work.
Right.
And we're not going to get into too many details, but basically, I mean...
Because that was your first question. Is this going to hurt?
Yeah.
And then they put the pad down.
I've heard all kinds of stories.
And that's Frances, correct? Was
Yeah,
that
that's
who our
Frances,
nurse
and she was amazing. She was so gentle. And, you know, every woman's going to have a different story. It depends on the size of your breast, I've heard. But I will tell you, there was no... I really thought they were going to take it and squish it like a pancake.
Right.
That is not what happens.
And that's what a lot of women's fear are when they come for mammography.
Compress it, and then they take a picture and they're like, okay, 1, 2, 3, 4. And I'm like this. I'm waiting for the part that hurts.
Yeah.
I didn't even feel it.
It's good. It's fortunate that you were comfortable during it. And some women, they have more pain during mammograms, and other women can tolerate it more. And the goal is to get good compression so we can see things well, very fine calcifications. There's not motion artifact throughout the exam. So I'm happy that you had a comfortable experience.
Yeah.
Women should realize that sometimes they are uncomfortable, but it's a few seconds. It's important to get good images and unnecessary evil, I guess I should say.
Okay, so why is this baseline so important? I mean, it's basically what you're going to compare breast health to in the years to come.
It is. You know, mammograms, you know, there was some controversy a couple years ago about when they start getting screening mammograms, how often to get mammograms. The recommendation is that you get a screening mammogram starting at age 40 and then annually or every year after that. Some women will go ahead and get a mammogram at age 35. Some doctors recommend that. And then additionally, if you have a strong family history of breast cancer, say your mother was diagnosed at age 33 or 40, then we recommend that you get a mammogram 10 years prior to your closest first-degree relative, so mother, sister, something like that. So
Is it like a snowflake? Is every breast different?
Every breast is extremely different. There's so much variability in breast size, density, normal, abnormal, and so there's quite a variability, and that's another important about getting your baseline mammogram is an important thing for a radiologist is looking at stability over time. So if something's been there for 5, 10 years, even 2 years, we don't care what it is. We presume it's benign, unless it has certain features that we, heighten our awareness. But for the most part, we want to see prior mammograms. We want to know what's stable, what's new, and what's changing.
So what did you, since you actually did the review, I mean, this tells me I'm healthy. Don't worry about it. But what did you see?
So actually, Lisa, you had what's a relatively easier mammogram to read. So breast tissue is composed of 2 elements, fat and fibroglandular tissue. The more fat there is, and women don't want to hear that fat is good, but fat is good.
I have it elsewhere, just not where I need it.
No, you look great. Fat is good on a mammogram because we can see through fat well. So you had, breast tissue that was predominantly fatty or had a little bit of fibroglandular tissue, so it's easy to read. We can see through things very easily. And basically what a mammogram is composed of, it's 2 views of each breast. Unless you have larger breasts or tissue that the technologist decides that they needed to get additional views.
Then they use Google Earth.
Coming soon to a radiology department near you. Well, so that's good to know. I did want to ask you one thing. I read an article as we were preparing for this show, and I can't remember now what it's called. I think it was like a lead shield, but it was a woman talking about mammograms. Her husband was a doctor, and she was talking about her experience and wanting to protect her thyroid from the X-ray, I guess.
From the radiation.
And if you should have one like on your lap to protect your ovaries. That is not something that came up. I didn't even know to ask. What do you think? Is that common? Should people be asking for that?
So some patients will ask about that. The first thing I'll mention is the radiation dose on a mammogram is very low. And it's very targeted to the breast. So there is a small amount of radiation that gets scattered to other parts of the body. So the thyroid, since it's, patients often leaning to get the appropriate position, there may be a little bit of radiation that scatters to the thyroid gland, much less likely to the abdomen. But it is very, very minute and nothing that is clinically or significant from a radiation exposure standpoint.
Okay.
Some women, you know, if they're pregnant, we have to do a mammogram. We will shield them. We will offer a thyroid sheet if a patient asks for it, but it's generally not the standard to do. And I can assure patients that it's very, very low risk of any radiation injury to any other parts of the body.
Okay. Well, I know it was a good experience for you.
Yeah,
so women shouldn't be alarmed at all. Or
and they gave me mints. Where's my bag? They had these lovely mints when we
No, they
left.
didn't give you mints. You took pockets full of mints.
Oh, you did too. Shoved them in your purse. Yeah, thank you for the great
Well, I'm
experience.
glad you had a great experience.
And the information.
Dr. Miller, thank you so much.
Thank you.
Okay, so just do it. 35 years old, just do it.
You're watching Good Day Columbus on Fox 28.
Start holding on, keep holding on. 'Cause when push comes to shove, you taste what you're made of.
And Good Day Columbus is going pink this morning.
Our Dana Turtle, he is live at the Breast Health Center at Dublin Methodist Hospital with a nurse navigator. This is actually where I went for my mammogram.
That's right,
Good to see you, Dana.
Yeah, good morning, Sean and Lisa. In fact, Lisa, this might have been one of the very rooms where you had your mammogram done. You can see the machines, and of course, you can see Susan, who is here. Hello, Susan.
Hi.
All right, so this is one of the rooms where obviously we get mammograms done, women. What does it mean to be a nurse navigator? What exactly do you do?
As a nurse navigator, we see the patient from the moment they come into the breast center. At Ohio Health, we are the only health system in Central Ohio that actually sees the patient before diagnosis. We see them as soon as they come in for what we call diagnostic imaging, which means if you came in because you had a breast lump, we would see you at that point when you come in so that you know our face. You would have your imaging, and then we would meet with you and the radiologist to get your results. If a biopsy is recommended, we help you get appointments set up. We are the ones who answer your questions, explain the biopsy procedure, and then there are also breast health nurses who follow the patients after their diagnosis. They're based in the hospitals. They see you the day of surgery and continue to follow you throughout your treatment process. Actually, we're like a friend who has extensive knowledge about breast cancer that follows you, walks with you every step of your journey.
So it's kind of like that familiar face that kind of walks you through the whole process of it as you're seeing various doctors and that sort of thing. All right, we only have a few seconds left, but this is a mammography machine right here. Is that the name of it?
Yes.
All right, so that's what they look like. So Lisa, I know that you were here for this, and Sean too.
Susan was my nurse navigator.
Oh, really?
Yeah, tell her hi.
Oh, Lisa said that you were her nurse navigator.
Yes, I was.
Did she behave when she was here?
She did behave.
She
was very, very good.
Okay, and then this is like the control center where the radiology technician stands, right?
Correct.
Okay,
Yes.
so there you go. That's a pretty neat thing to have people like you that walk the patients through all the process. It's scary.
It is.
Yeah.
And that's one of our main goals, is to ease that fear.
All right, so there you go. Lisa, Sean.
Thank you very much, Dana. All right. Well, in fact, you should show this is what she's.
Yeah, well, when I saw Susan, the first thing she did, you know, you go and you put on a robe. They take you into this really nice room, and she said, you know what these are? And I was like, no. It's a mammo wipe?
Mammo wipe.
I mean, I had no idea how the process works. So they tell you to put on a robe, and you have to use these if you have any kind of deodorant on.
And lotions.
Anything. They said in particular it's the deodorant that can mess up your skin. So you got to wipe it all off.
So like a good patient, she stole a box of mammo wipes. Okay.
Susan gave them to me.
Coming up next.